Good afternoon and welcome to NCCT Prep. Today we're starting the medical insurance section. So we're going to be talking about eligibility, verification, some Medicare, Medicaid information. Some of y'all I know have not seen this stuff before because you're kind of new to the program, and some of y'all will be very familiar with it. So just as always, if you need the packet, check e-learning and get with your instructor. And if you have any questions, feel free to reach out to any instructors at any time. All right. And like I said, we're going to kind of jump right in because this packet is pretty sizable. There's about 65 questions, I think. So we're going to kind of be expeditious with it so we can get through it. But as always, if you have questions, please feel free to ask at any time, okay? All right, so question number 1. Eligibility for Medicaid may change as quickly as daily, weekly, monthly, or yearly.
A.
It actually, if you go in and you try to verify Medicaid benefits on their website, it could change daily. Their status could change daily, but for the purposes of this, whatever their status is at the beginning of, like, they're not going to change status mid-month. They're going to be covered up until the end of the month, even if their status changes in the middle of it, right? So for this purpose, the answer is going to be C, monthly, because again, Medicaid's not going to end their coverage in the middle of a month. They're going to run through the whole, they're going to be covered for a month at a time, is the way their coverage runs. But it could change from month to month. And I've seen some that you check it one day and it's active and it's not going to be active after the 31st. And then you check the next day and it is going to be active after the 31st. And you just have to check it all the time. But yeah, the answer for this one is C, monthly. Which of the following processes require checking and confirming that the patient is a member of the insurance plan and that the member identification number is correct? Pre-certification, prior authorization, verification, or referral?
B.
B? No, it's not going to be prior authorization. A prior authorization is what you get before a patient has a procedure. You check with the insurance company to get a prior authorization to do that procedure. That's what prior authorization is. But when a new patient comes to a practice, someone in the office, and sometimes that's all, there are jobs, insurance verification. It's all you do. You sit there and you verify insurance and check in patients all day long. So your answer on this one is going to be C, verification. Number 3, patient's a 3-year-old. Both parents have private insurance coverage on the patient. The mother has a health care savings account. The primary insurance belongs to the parent, A, who was born first, C, with the healthcare savings account, C, with the earlier birthday in the year, or D, with the best insurance benefit coverage. What do y'all think that is? Any of y'all have that situation?
B.
With the healthcare savings account? No, that's not the correct one on this one. The healthcare savings account is just an extra that they have with their job. It really doesn't affect their benefits at all. It's going to be the C, with the earlier birthday in the year. Not which one's older, whichever one comes first on the calendar. Like if one of them's mama's birthday's in May and daddy's birthday's in August, it's going to be mama. Whoever's birthday is earlier in the year. Now, don't know. I've never been in that situation because my husband's never worked a job where they've had health insurance. So it's always been on my insurance. So, number 4, a child was seen by her pediatrician. The child is covered under both her father and mother's insurance. According to the birthday rule, the mother's insurance is primary. Why? The mother's older, mother's insurance has a lower deductible, the mother's birthday comes first in the calendar year, or the mother's insurance has a higher coverage rate.
C.
That's correct. You remember I told y'all they word the same question a couple of different ways? Here we are. Right. Which of the following statements is true concerning a court order about children's health insurance coverage after a divorce? The primary plan belongs to the parent whose birthday falls closest to the beginning of the year. B, divorce rulings have no effect on primary and secondary policies. C, the primary plan belongs to the parent whose policy was effective the longest. Or D, divorce rulings override the birthday rule. Which do y'all think that is?
Would it be A?
No.
D.
No. I'm sorry, did you say B or D?
I said D, she said B.
I said D as well, but I don't know.
It's kind of y'all technology. It comes through fuzzy sometimes. But if the answer is going to be D. Divorce rulings, any kind of court order situation is going to take precedence over the birthday rule or anything like that. Generally, whatever the court, when a judge says this is what goes, it overrides almost everything else. All right, number 6. If a married couple is covered under both spouses' health insurance and the husband is picking up a prescription for himself, he should A, get to pick which insurance benefits to use. B, use the insurance benefits with the least expensive out-of-pocket expense. C, use his insurance benefits alone unless he forgot to bring the insurance card. Or D, use both insurance benefits as they apply to this pharmacy purchase. What do we think?
Maybe.
The answer on this one is D. He should use both of them as long as they'll pay something on they'll pay his benefits. If both of them apply.
Insurance? Find something?
Huh?
You can use more than one insurance?
Oh yeah.
Oh.
Oh yeah. You can have primary, secondary, and then a third insurance, if you have that, is called tertiary. And most of the time, the only people you see with 3 different insurances are very, very elderly people that were generally government employees or military of some sort, and they have military coverage. They'll have a primary private insurance. They'll have secondary through the VA or something like that. And then they'll have a third, a supplement plan that covers everything that the first 2 plans didn't cover. And the third one is called tertiary. But yeah, you can have multiple insurances. They file to one, and then after that primary finishes processing, they'll file to the second one with the remainder of whatever's left over. Hopefully, if you have 2 insurances, you're not paying much out of pocket. Hopefully. All right, number 7. The patient has just left the doctor's office with a new prescription after a scheduled follow-up. If the patient's primary insurance covers the bill completely, her secondary insurance policy, A, is still going to be billed, B, is still going to pay the fee schedule, C, will not be used, or D, will apply the primary payment to the lifetime maximum amount. All right, so let me just say this on this one. If the patient's primary insurance covers the bill completely, then that's the end of the story. That's
We
all
see.
there is. That's correct. It'll be C. Will not be used for this visit. There's no point. If the bill's covered in full, why are we going to send it elsewhere, right? Or why would we bill somebody else and double dip? That would be fraud. So let's not do that. So yeah, the bill's covered completely. That's all she wrote. Number 8, the Medicare Secondary Payer Questionnaire is a form that A, patients fill out to determine if there is other insurance designated as the primary insurance. B, the medical office staff fills out to determine if patient is eligible for Medicare. C, the medical office fills out when they have confirmed that the patient has Medicare as a secondary insurance provider. Or D, the provider fills out when they are not sure if the patient has other insurance. All right, so let's break it on down. Medicare Secondary Payer Questionnaire. So this is asking somebody, they're asking the question, there's a Medicare secondary payer. So who's going to fill out the form? Who do you think is going to fill out this form? Who would you ask that question to? You'd ask the patient, right?
Yeah.
You'd ask the patient. So the patient's going to fill out this form. Patient fills out to determine if there's other insurance designated as the primary insurance. Because if there's something else primary, then Medicare is going to be secondary.
What was the answer?
The answer was A. The patient.
Okay, thank you.
Form. No problem. All right. Number 9. Which of the following should the insurance and coding specialist check in order to determine which payer should be billed as primary or secondary? The effective policy date for each carrier or their start date. B, the COB, which is called the Coordination of Benefits. It's another one of our acronyms. C, the AOB, which I think is like the application of benefits. If I'm not mistaken, I don't see that very often. D, the patient's employer.
A.
Anybody know this one? No, it's not A. It's going to be B, a coordination of benefits. Patients must, per almost all insurance companies, put in a coordination of benefits every 12 months. Every calendar year, they are supposed to get with their insurance company and let them know whether or not they have picked up another form of insurance, another insurance policy, and which of those policies is going to be primary or secondary. If you have a private insurance, like through your employer, but you also qualify for any Medicare or Medicaid benefits, that private insurance is always going to be your primary payer. Your private insurance is always going to be first before any type of governmental insurances. Okay, they want your private insurance to pay first before the government puts out anything. So every year you're required to put in a coordination of benefits. If you do not coordinate your benefits and there is any question as to if you have other insurance or something like that, your insurance company will deny every claim that gets sent into them until you tell them until you call them and tell them if you have other insurance or not, and whether or not their insurance policy is primary. Have to do it. A lot of claims get denied because patients don't coordinate their benefits. They just won't take the time to make the phone call to let them know, hey, I qualified for Medicare, or I'm qualified for Medicaid or whatever. So it's very, very important. And if you work as a billing specialist and you work denied claims, you're gonna get tired of telling patients to, hey, I need you to call Blue Cross and coordinate your benefits. You haven't done it. That's why they're denying all your claims. So either call and coordinate your benefits so I can process this claim, or I will send you the bill directly. All of it. That's sometimes how that conversation has to go. So coordination of benefits, very important. Which of the following statements is true for an employee on Medicare if he chooses coverage under the employer's group plan? A, claims should only be submitted to Medicare. B, the group plan will reject coverage and Medicare will pay 20%. C, the group plan will be primary and Medicare will be secondary. D, claims should only be submitted to the employer's group plan.
D.
What was that? Still didn't hear it.
D maybe?
C, definitely. Definitely. Your employer's group plan is considered a private insurance plan.
What's the answer? C?
B, yes, ma'am. The group plan will be primary and Medicare will be secondary. All right, number 11.
I have a
What you got?
sorry.
No.
So I work for Amazon and I just did my benefits plan thing. That would be my primary.
Yes.
Okay.
Yep. If you are yeah, if you have any other type of medical coverage, your group plan will more than likely be primary. All right, so number 11, which of the following determines the primary policy? And Angel, you're one of my new ones. We haven't been through this yet, but we're about to. You're actually about to go through the module where we're going to learn a lot of this stuff. So good questions. All right, so which of the following determines the primary policy if two plans cover a dependent child? The parent who is oldest, the parent who signs the financial responsibility form, the parent who's had insurance the longest, the parent who has the first birth date of the year. Check the answers.
Is it D?
That is correct. That is correct. All right. Number 12, the patient had United Healthcare HMO group insurance before she retired. Today, she presented her Medicare Part B insurance card and her husband's Blue Cross Blue Shield PPO group insurance card to the insurance and coding specialist. Which of the following is the patient's primary insurance for today's visit? Is it going to be the A, Medicare Part B, B, United Healthcare, C, Blue Cross Blue Shield, or D, Medicare Part A? All right, so we can, sorry, y'all, 1 second. Sorry. Okay, so let's do process of elimination. We can take out the United Healthcare, right? because that's what she had. It's not what she had. She had that before she retired. Okay. And that was apparently a group insurance with her job. So you can cross that off the list. So that leaves us with the Blue Cross Blue Shield, which is private insurance through her husband's employer, or Medicare Part A and Part B. So what's going to be primary?
C.
That's correct. The private insurance is going to be primary to your government benefits. 13, a patient was hurt at work and seen in the physician's office today. The patient is covered under Medicare and Blue Cross Blue Shield and is also covered under workers' compensation for this injury. Which of the following is the primary insurance and the secondary insurance? A, workers' compensation is the primary, Blue Cross is the secondary. B, Blue Cross is the primary, workers' comp is the secondary. C, workers' comp is the primary, Medicare is secondary. D, Medicare primary, workers' comp is secondary. All right, so anytime it's a workers' compensation claim, workers' comp is going to go first. They're
Okay.
automatically going to be primary. Workers' comp is it's a whole it's a whole nother ball game in billing. It's a lot easier to get paid sometimes depending on the situation, but it is always going to pay first in those cases. Always, always, always. Anytime you see workers' comp or WC, use acronym for that too. WC, workers' comp, always primary. All right, so what do you think is going to be the secondary, Blue Cross or Medicare?
Medicare.
No.
Blue Cross, because Medicare is still at the end, being that it's a private insurance.
Being that Blue Cross is private, it's going to go before Medicare. Very good. Very good. All right. So, any questions about that? No. All right. So, number 14. Place the options below in order of claim submission where all insurances are relevant. Click and drag the options in the left column to the correct position in the right column. Okay, so we're not going to click and drag. Y'all just tell me which one is going to come first. But let's look at our list. So we've got Humana, which is a private insurance. We've got ABC Auto. So obviously, this was an auto wreck of some kind, right? Because their auto insurance is involved. And then we've got Medicaid and Medicare. All right, so auto accidents where automobile insurance is involved is similar to workers' comp in that it's always going to come first. It's always going to come first in the claims process. They just come first. They just take their stuff off the top, put it that way. It's an auto accident, so that's their area of expertise. They do their medical payments off top, just like workers' comp. So what's going to be second? So with that, ABC Auto is definitely going to be number 1. What's going to be number 2?
Anna.
Correct. Humana. Their private insurance is going to be next. All right, so now we get to Medicare and Medicaid, which are both governmental agencies. But if you've got a Medicare and Medicaid situation, and that's the only 2 insurances that they have, Medicare will always be first. Medicaid, generally, if somebody has anything other than Medicaid, whatever other insurance they have, regardless of what it is going to be primary to Medicaid. Their Medicaid will always be secondary. And there's even a program out there. If you qualify for Medicaid, and this is valid for the state of Louisiana, because when I was pregnant with my daughter, I took advantage of it. I had Blue Cross through my employer at my billing specialist job, but I also qualified for Medicaid. Medicaid will actually reimburse people for what comes out of their check for their insurance premium to keep their primary coverage. So if you happen to currently qualify for Medicaid and you go to work for ABC Billing Company or what Dr. Smith or whoever, and they offer you insurance benefits, don't automatically think that you have to drop your Medicaid. You may not have to, and you may also be able to get reimbursed your premium that's taken or part of it, depending on your situation. So not everybody knows about that program, but it's out there. But Medicaid is, unless it's the only thing they have, will always be secondary to any other type of insurance coverage. Medicaid is always going to be last on the list. They are there to pick up what people can't afford to pay, the remainder of what they can't afford to pay. All right, so number 15, after a patient is seen for a follow-up visit, the physician orders additional diagnostic testing. Which of the following does the insurance and coding specialist need to obtain? A, an allowed amount, B, a pre-authorization, C, advanced beneficiary notice, or D, a referral. So let's do process of elimination on this too. An ABN, advanced beneficiary notice. We can cross that off the list because we know that that is a Medicare only form. We talked about that during claims. That's a Medicare only form. And our little scenario up here doesn't say anything about Medicare. So we can take that off. A referral, we're not sending him to any kind of specialist. We're just getting some test runs. So we don't need a referral. We're not sending him anywhere. So a pre-authorization or allowed amount. We're not going to know the allowed amount until we start filing claims. So we can cross that off the list. So it is a pre-authorization. And pre-authorization and prior authorization are a lot the same, kind of interchangeable. But either which way, it's for services that you have to talk to the insurance company in advance and get approval, some type of okay, yeah, that's a payable procedure, because some of them are not. And then you can't get a prior author. They're not going to approve anything, but you're going to know up front that, hey, insurance isn't going to do anything for this. So it's going to be all at the patient's expense. All right. And you will also see they have notices, prior authorizations or pre-authorizations are not a guarantee of payment. They're just saying, yeah, we do cover that service sometimes. Doesn't mean they're going to cover it in your instance. So keep that in mind. Okay. Number 16, a patient is referred to a specialist by the primary care provider. Pre-certification is required for this patient's specialty visit. Which of the following actions is required by the insurance and coding specialist to obtain authorization? A, contact the patient's specialist. B, have the patient submit a paper claim. C, contact the patient's insurance provider. Or D, submit the CMS 1500. What do we think it's going to be?
C.
That is correct. They have to contact the patient's insurance provider to get their pre-authorization.
Could you tell me the answer to 15 again? Sorry, my daughter's home and keeps asking questions.
That's all right. Number 15 was B, pre-authorization. All right, number 17. When submitting a request for a pre-authorization, the billing and coding specialist should A, wait until the procedure has been completed. B, submit codes for any scenario that may arise during the procedure. C, not code anything higher than the procedure that is expected to be done. Or D, submit the request as close to the data service as possible. All right, let's take D off of that list because we never wait till the last minute, right? Like, why would we do that? So that's not even a thing.
Is it A?
It is not. You can, all right. Pre-authorization is done before the procedure. So you can't wait until the procedure's been done because then it's too late. Then it's too late. The before.
Maybe C.
D?
No, it's not C. You don't want to not code anything higher than what's expected to be done, because what if something happens? What if they have to do extra? The answer is going to be B, because you got to see why you're A, y'all. You got to see why you're A. You're going to submit codes for anything that might happen during that procedure. Anything that could go wrong, to take this from a normal run-of-the-mill procedure to the patient coded and we had to do X, Y, and Z. You got to cover your bases. You got to cover your bases, because say something does happen in that procedure and you didn't submit codes for that, they didn't pre-authorize those codes, then you're going to be out of luck. You go, no, we didn't pre-authorize that. But if you submit codes for anything that may happen, you're covered. You're covered. All right. Which of the following is likely to be a cause for delay in receiving prior approval for a procedure or service from the insurance company? A, the procedure submitted is not included on the policy, meaning it's not a covered benefit. B, the data service is not far enough in the future. C, the resident performing the procedure is not credentialed. Or D, the service will take longer than normal. What do we think the answer is? And I think we could probably take B off of the table, because we can't have, it's up to the doctor as to how soon this patient needs to have this procedure, not up to the insurance company. So they can't say it's not scheduled out far enough. That's not a thing.
Is it A?
That's correct. That is correct. The procedure submitted is not a covered benefit for that patient. It will delay every time. All right, so number 19, which of the following statements is true about pre-authorization? A, it guarantees payment by the payer for treatment of surgical services. It guarantees payment by the patient for treatment of surgical services. It only pertains to medical necessity. It is not a guarantee of payment. Or D, it only pertains to the assignment of benefits, is not a guarantee of payment. So what do y'all think? Let's see, what did I say a couple minutes ago about the notices on prior authorizations? Prior authorization is not a guarantee of payment.
Yeah.
So it does not guarantee payment, ever.
D?
C.
C.
C. It only pertains to medical necessity and is not a guarantee of payment. It only says that, okay, yeah, we understand what the doctor's saying, that we understand that the patient needs this procedure and it's a covered service. That's all it says. Number 20. And this is our last one, guys. We're going to wrap it up. Number 20, pre-certification is A, an approval from the insurance carrier to perform a service. B, a letter recommending treatments for a patient with a congenital disease. C, proof that a patient has insurance coverage such as a card or letter. Or D, guarantee of payment for a specified service.
B.
Nope. Nope. The pre-certification is almost the same thing as a pre-authorization.
A.
That's correct. A, an approval from the insurance company to perform the service. Sure, you can perform the service, doesn't mean we're going to pay for it. But you can do it. We understand that you're doing it. All right, and that's where we're going to stop for today, guys. We got about 30% through insurance, so that's pretty good. We did pretty good in that time frame. I know we kind of went through it really quick. Think over what we reviewed. Read over your packets. If you have any additional questions, get with your instructor or get with myself. And if y'all do y'all have any questions for me as far as insurance, primary, secondary, tertiary, claims filing for those? I can answer all those questions. Like insurance and claims is my jam.
But it's about the packet.
The packet, you check your e-learning page. There's an NCCT prep page, and I'll go and make sure that I do have this pack. I'm pretty sure I do have this packet on there, but if not, it'll be on there in the next little bit.
Okay.
All right. Anybody else got anything? I'm the claims and denials girl, y'all. Come on.
Not
Nothing?
right now, but I'm pretty sure in the
Y'all may come up with stuff as we go through it. And if you've already been through it, and your instructor probably did an awesome job, which is why you don't have any questions. All right, guys. Well, y'all have a wonderful week, and I will see you next Tuesday at 2:00.
okay.
Bye-bye.
Bye.